Welcome to the Dr. Mudgil podcast. This is episode 210, and we are in the final throes here of November. It is Thanksgiving week. Full disclosure, we're recording this podcast on the Tuesday before Thanksgiving, so that by the time you hear this, Thanksgiving will have passed, and I hope your bellies are still full from a wonderful, whether it's a early dinner or late dinner with your family and friends and loved ones, and your bellies are still full of turkey stuffing and apple pie and all the great stuff that most families enjoy during Thanksgiving. Hope you enjoyed some football on Thursday, and I hope you're enjoying some college football this weekend. I'm looking forward to a big game on Saturday night. UVA is playing Virginia Tech, and my daughter is going to be home from college for the weekend, so the Mudgil 5 are going to be back together, and we already have plans. We're going to watch the football game, and my wife is going to make some wings and nachos, and it's going to be the best. So I'm really looking forward to that. But like I said, we're a couple of days before Thanksgiving when I'm recording this, and my mind is in a Thanksgiving mindset. And I want to share a little bit of story time, share a couple of stories from this weekend. And I think they capture the spirit of Thanksgiving quite well. So first things first. So on Friday night, my wife and I, Fridays are a very early day for me. I see patients in my Manhattan office. And I start early, but because I live in the burbs, my day has to start very, very early. So my day starts in the late 4s, early 5s. I get ready for work and I head into the city. I'm usually in my city office by 6:30, 6:45 a.m. But traffic being as variable as it is on the Long Island Expressway, I err on the side of leaving very, very early because I want to make sure I'm at work on time for my first patient. So usually that means I'm actually there about an hour or an hour and a half before I start seeing patients. But as you know, I'm also a pathologist, so I use that time to read slides. I read my slides for the day before the patient care day starts. So Fridays are an early day, and I end early, like my day ends early, but because I'm in New York City, it can literally, it's 25 miles away. My house is 25 miles away from my office, but it could take me hours. I'm not kidding. It could take me like 2.5, sometimes even 3 hours to get home. But I'm usually done with patients around noon. I'll grab some lunch in the city and I will head home. So I'm usually pretty tired on Friday nights, and my wife and I will usually do like something like very, very low key and chill. So there's a pizza place that we love in a town near us. It's a very, very small place, and they have a great playlist. They play tons of like Grateful Dead music and Jerry Garcia stuff and some Fish and all the stuff that I love. My wife, not so much a fan, but she's a big fan of the pizza there, and I'm a big fan of the pizza and the music. So it's one of our spots that we like to hit. It's a very, very casual spot, and it's a good comfort food, great way to end the week. So this Friday, my wife and I went. And my brother-in-law, my wife's brother, happened to be in town, and so the three of us, he actually joined us for dinner. So the three of us went out to dinner. We sat at the bar, we had pizza, a couple of glasses of wine, perfect night. And then when the bill came, it was, because my wife and I were going to go anyways, and, my brother-in-law joined us, I naturally picked up the tab. My plan was to pick up the tab anyways. But of course, as is customary, my brother-in-law brought his credit card out, and I said, listen, man, I got it. Don't worry about it. And then, a little bit of back and forth about who's going to get the bill. But of course, I picked up the tab because that's what I wanted to do, but also because it's kind of awkward splitting a bill, like 2/3 on one card, 1/3 on another card. The bartender's a busy person. So it was my pleasure. It was great company. I had a wonderful dinner, and it was my pleasure to buy what turned out to be not a very expensive dinner anyways. It was pizza, a couple glasses of wine, a couple of drinks, whatever the case may be. But that was on Friday night. And, we had a very busy weekend. My little guy was playing in a basketball tournament in Brooklyn, so I was out of the house all day Saturday. My wife was out of the house on Sunday. We kind of split the tournament schedule up because my middle guy needs to be shuttled around as well, and you know how it is. So on Sunday when I was home, a box arrived, and in the box it was like a pretty sizable box, and it turned out to be a gift from my brother-in-law. So during dinner, we were talking about, just my wife is become quite the chef these days, and she's always looking to make different things. My boys are picky, and they put their requests in, and everything my wife makes, I love. I I devour tons of protein. So whatever protein's in front of me, I will eat. So we were talking about, she made a brisket, and we're talking about making a brisket, how you have to use a slow cooker, yada, yada, yada. So my brother-in-law actually sent us a slow cooker as, a thank you for buying him dinner on Friday night. Completely unnecessary, but it was actually so thoughtful and so nice. It was such a nice gesture of him, for him to do for us, and he's a good guy, and it was very, very kind, and it made us feel really, really good and feel blessed to have him in our life, and it was a very nice thing. So keep that in the back of your mind. I'm going to segue to another story. So on Saturday night, my wife and I had dinner with another couple, and I'm just going to give you guys a little bit of background information. The gentleman from the couple we went out with was actually the orthopedic surgeon, the spine surgeon that did my back surgery a few years ago. And I'm sure I've told this story in some iteration through the years, but I was suffering from horrible back pain for many, many years. There was a Saturday where I was shoveling snow in my old house, and then I was working out and I was doing deadlifts, and I pulled a muscle in my back pretty badly, and things were never quite the same. And I would have periods where my back was feeling fine, but as the years went on, my back pain became more and more debilitating, and I would just deal with the pain. I would still work out through it. Sometimes I couldn't even get up off the bench, or I have to roll off the bench. And stupidly, I kind of worked through the pain, and everything kind of came to a head during COVID. We were away. The kids were off for the week of President's Week in February, and we were down in Miami. And my back was really, really bothering me that week. In fact, so much so that I was so accustomed to just dealing with the pain. But my wife would tell me, when you're getting up to go to the bathroom in the middle of the night, you're literally grimacing and crying in pain. And I remember it was a real struggle. It was a low platform bed at the hotel that we're staying at, and it was a real struggle for me to maneuver myself out of the bed. And being the old man that I am now, I have to go to the bathroom in the middle of the night, pretty much every night. But foolishly, during that trip, even though I was having all of this back pain, there was a really nice gym at the hotel we were staying at, and I would tell my wife, "Hey, I'm just going to go to the gym just to stretch out my back. It's feeling really, really tight." But of course, I would go down to the gym and force myself through whatever that workout for that day was. We finally came home on a Friday night. I remember Saturday, I had to go into the office to see a patient, but I worked out that morning of, and while I was working out, I could not move my left leg at all. I was basically completely paralyzed, and I said, "Uh-oh, this is not good." So I took a picture of the limited mobility that I had. I literally could not lift up onto my toes at all on my left leg. And I sent it to my friend, who is an orthopedic surgeon, and I had mentioned to him weeks prior that I was having some back pain, and I really need to get this sorted out because it's getting worse and worse and worse. And the plan was, okay, I'll come in to see him, and we'll try a cortisone shot, and see if that helps, and kind of work our way through the treatment protocol. But I shot him a picture. I was like, "Hey man, I think we may need to skip the cortisone shots, and I think I'm going to need surgery sooner rather than later." And I said, "Yeah, it looks pretty bad. Why don't you get an emergency MRI?" So I got an emergency MRI on that same day. So I got back from Miami Friday. Saturday, I went to the office to see a couple of patients, and then right after I was done with patients, I went to get an emergency MRI. And it's based on whatever those findings were. The plan was, okay, we'll figure out what the next steps are. That night, I was at an Indian restaurant with my family. It was about 8:30 at night. My cell phone rang, and it was my friend, the orthopedic surgeon, and he said, "Hey, you have a really, really bad herniation. I have multiple herniations in my back, but one was so bad. And it was so bad. It was an L4, L5 herniation and an L5, S1 herniation. But the L5, S1 was, he said, one of the worst herniations he'd ever seen. And he asked me, he's can you control your bladder and your bowels? Because it was very far down in the spine where, lots of things are innervating that part of the body. I said, yeah, no, everything's fine on that front. He said, listen, I'm on call this weekend. You need to come to the operating room tomorrow. We have to do emergency surgery on your back. So this is 8:30 at night on a Saturday. And this was during COVID. It was February of 21. So the COVID vaccine had just come out, and but you really couldn't have visitors in the hospital and that sort of stuff. So he said, I'm working at such and such hospital. Have your wife drop you off at the emergency room, and then you have to go through the COVID protocol. So you basically had to get tested for COVID, document a negative pregnancy test. Document a negative COVID test before you could go back to the operating room. So I got there at 8 in the morning, and I think about like 2 or 3, I was cleared to have surgery. I went to the operating room. My friend and his colleague, who was a neurosurgeon, operated on me, and then I woke up in recovery. And then at like 10:30 at night, they wheeled me up. My wife picked me up. It was literally the most bizarre thing. And then, my back felt much better. There were a couple of setbacks, just with the recovery. But overall, things were great after that. And, I've done a lot of work on my back. I did this specialized stretching called Eldoa, which one of my friends referred me to, and I went every week, and I was working with a therapist, and he gave me a series of stretches, etc., which I do literally every day. And sometimes I do them twice a day. If I play golf, I'll do another set of those stretches. But, my back, knock on wood, wherever some wood is, but has been doing amazing well, and it's been years. And that's sort of like the setup for the story. So we had dinner with this wonderful doctor and his wife on Saturday night. And when the check came, I grabbed the check and I said, I'm going to pick up this tab, man. And of course, he's like, no, we're going to split it. What are you talking about? And I finally had the chance to tell him how he changed my life. He basically saved me. I was suffering in so much pain. I could barely get out of my car. I could barely get out of bed. I could barely work out. In fact, I was in such bad shape that my leg was paralyzed. And this guy literally saved my back and improved my life infinitely. And in fact, the Saturday that we had dinner, I was actually working out back. Saturdays is my back day. And I remember thinking to myself, I was like, I would not be able to do this if this wonderful magician of a doctor didn't fix my back. And I was explaining to him and his wife that, no, it's I must buy you guys dinner tonight. It is absolutely the least I can do. I owe you a lifetime of gratitude. I'm so grateful to have you in my life, and I'm so appreciative of everything that you did for me. And I can never, ever repay that debt to you, but please, at a minimum, let me buy you dinner tonight. And it was a nice moment. And I felt great being able to do that. So what does all of this mean? What are these stories all about? Well, there were 2 amazing events of gratitude this weekend. One, I was on the receiving end of one where my brother-in-law was so kind and generous and thoughtful. It was just such a personal gift for him to send to us, and it felt so good to be on the receiving end of gratitude. And I was also able to express my gratitude and be on the giving end of gratitude. And although it's a debt I can never, ever, ever in my life repay this amazing doctor, it just felt good to be able to, in the flesh, outside of professional life, to be able to share how grateful I am to have him in my life and to be the recipient of the magic he's able to perform. So with that is what I'm thankful for. Thanksgiving is a beautiful holiday where we all have a chance to reflect on these amazing things and people that we have, all of us have in our lives. And God, just a little more gratitude in the world just makes the world that much better. So I hope you all had a wonderful Thanksgiving, and I hope you all have a wonderful, restful, productive week ahead, and just finish out this year strong. It's got a month left. So with that, let's get it.